Hello and welcome to Health Show with Amara from our London studios. I'm Dr. Amara Sohail. Our topic today is parathyroid gland and the diseases related to it. We chose this topic amidst a controversial statement by a prominent politician from Pakistan, whose statement suggested that parathyroid diseases can only be treated in Switzerland and America.
पैराथायरॉयड का इशू है। मेरी लास्ट ईयर जनवरी में सर्जरी हुई थी स्विट्जरलैंड में, और मुझे ये भी सुनने को मिल रहा है कि पाकिस्तान में कोई हॉस्पिटल नहीं है जहाँ पे सर्जरी नहीं होती। मेरी जो जितनी भी इलाज हुआ है पाकिस्तान में हुआ है, लेकिन ये एक ऐसी बीमारी है पैराथायरॉयड की जिसका इलाज सिर्फ दुनिया में 2 मुल्कों में, इंग्लैंड में भी इलाज नहीं है, या स्विट्जरलैंड में या अमेरिका में।
To find out how true this statement is, we have invited an expert endocrinologist, Dr. Gul Bano, who is a consultant endocrinologist in one of the teaching hospitals in London. She is going to tell us about what this gland is and what are the diseases related to it. Let's welcome Dr. Gul Bano, who is joining us via video link today. Thank you very much, Dr. Gul Bano, for joining us today to throw light on this part of human body, parathyroid gland and the diseases related to this gland. So please tell us, what is this gland first of all?
Thank you very much, Amara. And hello, everybody. This subject is very close to my heart because it's one of a daily routine practice for endocrinologists anywhere in the world. So let's start. What is a parathyroid gland? In fact, there are 4 parathyroid glands, not one. They are located just behind the thyroid gland, and their main function is to regulate calcium levels in the blood. Bearing in mind is a functioning gland. Majority of the problems which can be associated with these glands are benign. They can be easily treated. As there are 4 glands, taking out one gland is not going to affect anybody's health in any way. So, what are the diseases which can be associated? First of all, it's one of the commonest endocrine problems. 7 out of 1,000, particularly women above the age of 60, will have increased levels of parathyroid hormone. So, what is its function? Parathyroid, basically, it regulates calcium in the blood. And calcium is very critically regulated. That means a slight increase or decrease can affect the metabolism. So what happens is when one of the 4 glands doesn't follow the command or the rule of endocrinology and it starts to work on its own, then this problem of parathyroid gland happens. 80 to 90% of the cases are just because of a single gland problem, is a benign adenoma which produces high levels of parathyroid hormone. Remember, most of the calcium is present either in bones or in teeth, and very little is present in blood. So when this happens, the parathyroid hormone is not regulated. It mobilizes calcium from bones into the blood system, and the level of calcium will increase. The level of calcium it increases, it can affect, if it's for a long time, it will affect the bones. They can become thin, and it can deposit calcium in abnormal places like kidney, like blood vessels and things. But in present day and time, if you are having regular health checkups, for example, politicians and everybody, then this should not be missed. It should be picked up at a first opportunity when it's available.
When you said that the calcium is deposited in abnormal places, so do people then feel what's going on? There is something else going on in their body. How does it show in a normal person?
The commonest presentation is a routine blood test, and patient has no symptoms, and a high level of calcium is picked up.
So, Gul, tell our viewers what do people feel when the calcium is deposited in the wrong places? What are the symptoms of this disease?
Right. So the commonest symptoms would be, if it has been ignored for a long time, would be kidney stones is a common manifestation of this disease. The second thing is non-specific symptoms. A lot of it is attributed to aging, like aches and pains, like acid reflux or heartburn, and fractures or thinning of bones. That is what we describe as osteopenia or osteoporosis. So this disease has to run at least 10 to 16 years before it can manifest with symptoms which you can correlate clinically. Otherwise, they are very non-specific symptoms. In
Somebody has got
Western
kidney
world,
stones,
because
do you routinely check them for the
yeah,
level of this hormone in the body?
yes, we always check for the level of calcium and parathyroid hormone.
Okay.
Because
And
parathyroid
is it a
hormone,
something, it's life threatening, you think?
no, never. It's not a life threatening unless the serum calcium level is very, very high or people are dehydrated. It's very well tolerated because anything in a human body which happens over a long period of time, the body can adapt. If it happens very acutely, say for example, severe dehydration and things, then symptoms are much more pronounced. So
Okay.
in no
And
ways
does
is
it
a
need surgery to treat the problem then?
yes, that's where I'm coming from. So, like I said, there are four parathyroid glands. It is usually one gland which is not forming the normal physiology. So, what do? They try to find out why calcium is high and why parathyroid hormone is high. So, we do the testing. We test calcium, we test vitamin D, we test parathyroid hormone, and yes, all three are abnormal. Then we go on to localize which one of the glands is not functioning properly. And there are very good techniques. It can be done very expertly. A person who is an ultrasonographist can tell you that whether one parathyroid is enlarged or there is a nuclear scan which can be done. And the nuclear scan depends on you inject a nuclear material everywhere it washes out, but the gland which is functioning abnormal, it will retain it longer. So that's the gland which is abnormal. And in such cases where you have high parathyroid and calcium and you have a gland, it's preferable to have surgery in order to avoid the long-term consequences of this disease like kidney disease, renal calculus, or thinning of bones, and other associated symptoms. But
And
generally, it's a benign
is the
disease.
surgery for, is it a surgery which is kind of, which can put somebody's life at risk?
It is a keyhole surgery, is a what we call as a focused parathyroidectomy. Out of the four, one gland is a patients generally have a day case surgery in this country, and anybody who deals with the neck and had problems should be able to remove this gland. It's
But I
not
mean,
a
the thing
complex
is that
surgery.
this statement that the surgery is only available in 2 countries in the world. So, are you
Yeah.
saying that that's not the correct statement? The
No,
treatment is available
that's
in
not the
UK?
correct statement at all. Anybody who can do a surgery on thyroid or a neck can do a surgery on parathyroid gland.
And what
This is
about
not true.
countries like India, Pakistan? Do you think these countries they also offer the
Of
treatment?
course, of course, I have seen patients both from India and Pakistan. They have had a wonderful surgery, very localized, focused parathyroidectomy in their countries. It's available. Anybody who is a trained head and neck surgeon should be able to do it. I don't see the reason to travel and just to say USA and Switzerland. What about UK? My hospital is a tertiary referral center for all these problems. That's not true.
But I mean, when this statement, did you think that it was important to raise awareness amongst public that this is not, because a lot of people started panicking and they thought maybe we have the problem and we do not have access to specialist centers very specifically in the world. So, what would you tell public? What signs should they be looking for to pick up this disease, and if it is diagnosed, then should they worry or should they not worry? So please tell us what public should know.
Yeah. So the public should know that it's a very common endocrine disease, particularly in women about the age of 60. So number 2 is a benign disease. Whenever you go for any kind of a test to your doctor, please ask them to check their serum calcium and parathyroid hormone. It's available in any laboratory. And if both are high, then yes, you go to a specialist to find out which one of the glands is a problem. And have surgery done because the onc is a curative treatment. And it's also bearing in mind the level of calcium depends when you intervene. If the levels are less than 2.7, and these are the guidelines which are throughout the world, Society of Endocrinology, if a person is less than 50 and levels are more than 2.7, or they have kidney stones or kidney function abnormality or thin bones, then offer them surgery. So that means if the levels are less than 2.7, patient is fit and well, no complication, there is no need even to bother to do a surgery at that stage.
Okay.
So
And
it's not
before
something
the
which is going to
gland
kill
becomes
you.
dysfunctional or there is a problem, is there anything in the diet people should take that can help improve the problem or prevent this complication?
Yes, it's a very important question. The most important factor, which apart from calcium and parathyroid hormone, is vitamin D. Vitamin D also regulates the calcium levels. So we know that a lot of people are vitamin D deficient. So their parathyroids will overwork to help the absorption of calcium. So what I'm trying to say, please make sure the vitamin D is taken in a required quantity, particularly in countries where there is less of sunshine or where
You mean
diet is
UK?
poor. Yeah, UK,
We've got less
and also
sunshine here.
in countries where diet is poor in, because vitamin D is mostly present in meat, fish, eggs. So that is kind of a rich kind of diet. So it's a very simple way to treat. Just give them or enough of milk or just one tablet of vitamin D will not do any harm.
Dr. Gulbano, tell us, I mean, you said that in countries where there is sunshine, having sunshine is not a problem, but there is smog. Do you think that smog prevents the exposure to the ultraviolet rays, and hence people should take vitamin D as a precaution because they may not be able to activate the vitamin D?
Yes, it's true because smog doesn't allow the rays to filter through. And secondly, we have to bear in mind that in subcontinent, a lot of people are vegetarian, particularly in India, and they don't get enough vitamin D. And secondly, also people are not that conscious of replacing if they are not taking something in diet with a vitamin or anything. So vitamin D deficiency actually should be is more prevalent and should be treated more radically than it is done currently. So smog definitely has effect on this because the first port of absorption for vitamin D is skin under the effect of sun rays. If you don't get that, you don't start absorbing vitamin D at all.
And is there anything people should do to improve their exposure to sunshine or sunlight in countries where there is problem with smog? What should they do? Because of course, like apart from taking vitamin D, which is the supplements, what
Yeah.
can they do? Is there anything we can tell them?
Yeah, just healthy diet. That their diet should include an egg. Their diet should include milk, and other thing which like I touched based on was the bone health. So exercise is very important.
And other thing I wanted to ask you was that if people have a problem and they've had a treatment in the form of surgery, does it affect their lifespan or the number of years they live after the surgery? Because of course, like as I said, a lot of viewers were panicking that, oh, if they may have a problem and they don't know about it. So should they panic or should they not worry too much about it?
No, they should not panic. People live on one kidney after transplant, and there are 4 glands which are there. There are 4 glands. So one taken out, it doesn't make any change to anything.
Right.
So there is
So,
no need to panic. In fact, it is a curative treatment. Removing one gland will always help to cure the disease.
yeah. So does that mean what you are telling our viewers is that it's a complication which is not life threatening, it is not as scary as people think it is. The treatments are available everywhere, not necessarily in the developed world, but in the countries that are developing, they do have doctors who can treat the problem without and requiring any special equipment or treatment. So public should not be scared,
There is
and they
no
should
need,
just
yeah.
stay calm and improve their diet. So one last message directly to people on healthy lifestyle before we end the show, Dr. Gulbano.
So it is what we call as a healthy lifestyle is not only about exercising and lifestyle changing, it is eating healthy. So eating healthy means a balanced diet and look after your bones and muscles by doing a light exercise, just 20 minutes walk every day, and just be aware of any health issues, not among yourself, but also in the families. So that's really very important issue. Besides, like I said, right at the start, is a very common disease. It affects a lot of women and it does not shorten the lifespan. There is no need to panic. Any qualified surgeon should be able to deal with it, and everywhere investigation panel is available. Unless we are being told a lie that it is a parathyroid disease, something more than that. I'm sorry.
So viewers, you heard Dr. Gulbano, an expert in this field, that there's nothing to worry about having a problem with the parathyroid gland because it doesn't affect the years you live and it doesn't affect your health big time, and there is treatment available in any parts of the world. So we hope that you benefited from the show, and we look forward to seeing you next time. Thank you very much.